I'm Dr. Kenneth Iguda, consultant gynecologist and an IVF specialist. Are there any restrictions to be considered while you are undergoing an IVF treatment cycle? I consider this question a very important one because daily we observe that clients or patients are involved in a whole lot of social activities or consumption of substances that may be detrimental to not just the IVF treatment cycle, but to the entire process of pregnancy. One of such things that should be restricted is consumption of coffee. A lot of studies have identified coffee to be detrimental to the quality of eggs, the quality of embryos, and also the process of achieving pregnancies. So if you ask me, I would say no alcohol at all is a safe limit for alcohol consumption during an IVF treatment cycle. Consumption of tobacco or cigarette products are associated with increased level of nicotine in the human body, and this has been proven over and over again to affect the quality of eggs or even the quality of sperms. And of course, you can only expect that the outcome may be reduced or affected when these substances are in the human system. Sex is important, but I think it should be restricted or avoided following embryo transfer. This is because the process of intercourse is associated with orgasm, and what happens physiologically during orgasm, there is contraction of the pelvic floor muscles, and there is also contraction of the uterus. And this contraction can actually be rhythmic and frequent within the period it lasts. This may be detrimental to the primitive cells, the embryos, soon after embryo transfer. I will also advise that extremes of emotions, especially negative emotions, like in quarreling, anger, and anxiety, should be reduced or avoided because this may be associated with elaboration of hostile chemicals in the human system, and that can be detrimental to the process of achieving pregnancies. Illicit drugs should also be avoided, and there are a lot of food substances that are being talked about currently that may not be helpful with the process of conception. These may all be looked up and avoided. You could access more of this information from our website, or better still, have a direct conversation with an IVF specialist. Until I come your way next time, thank you so much for viewing. I'm Dr. Kenneth Iguda, consultant gynecologist and an IVF specialist.